consult a nephrologist related to these issues?
That's a very relevant question, because if we wait to have symptoms from kidney disease, it is going to be a bit too late. Very few people, if any, develop symptoms very early on during the course of the kidney disease. Sometimes people with glomerulonephritis or interstitial nephritis might see some blood in the urine or some frothing of the urine, which is protein leak in the urine. And this might be a bit early on during the course of the disease. And it might be picked up that way. Or they might develop headache because of high blood pressure, and it might be picked up because of that. When we do the test, a simple test called creatinine of the blood or a urine routine test, we might pick up abnormalities in the blood and the urine, and then they might get referred on to the kidney specialist. However, most often than not, these symptoms are quite late, especially when it comes to poorly controlled hypertension and diabetes. Unless we check the creatinine and urine for protein or blood from a very early stage regularly, we will not be able to pick it up early on. So the bottom line is, most of the time it is asymptomatic. The only way we can pick it up early is by doing a regular test from a very early age. Even though you are very healthy, we have to check, because the prevalence of hypertension and diabetes in Indian population, this includes the rural population as well. About 20% of urban and rural population are diabetic now, but probably less than 1% know about it. And up to 40% of people are having hypertension by the new guidelines, guidelines brought out by American Society. But even if we go by the International Society of Hypertension, about 30% of people are hypertensive. And these are young people. I'm talking about young people in their 30s and 40s. These are hypertensive. So unless we check and then give appropriate importance to it and not brush it off, we will not be able to treat it, and we will not be able to prevent not just kidney problems, strokes, heart attacks, and heart failures.